Heartistic Journey, Series 2. Tensions of Time Journeying Towards Recognition of Heart Disease, captured by thematic photography. How much time does it take for a person to recognize symptoms that are linked to the development of heart disease? Yes, but how often does a person run out of time, ignore their warning symptoms of intermittent, intense chest pain, or overwhelming fatigue or increasing shortness of breath, and then suffer a heart attack? Time can be thought of as a continuum, one that is anchored by the past, present, and future events. Time has been categorized as a measurable entity or a period where actions, processes, or conditions exist or continue. The undercurrents of time were explored in a supplemental qualitative analysis of 23 men and women diagnosed with heart disease using a creative arts-based level of interpretation to create 3 thematic photographic series entitled Borrowed Time, Timed Out, and Recovered Time. Unexpected, unprovoked, and unusual early warning signs of heart disease are very hard to recognize as related to the impending heart disease and are regarded as a problematic issue to realize by individuals who have experienced a heart attack. Through ruminations in the days and weeks following a heart attack, survivors experience an array of different thoughts and feelings. Recognition that these early signs, prodromal symptoms, were an alert or an indicator to pay attention to in the development of heart disease came as a complete surprise for some after the fact. The process of recognition has been described as a liminal time, one of deep introspection, consumed with feelings of anxiety, confusion, uncertainty, and regret. This uncertain or liminal existence, during which individuals become aware of intruding symptoms of cardiovascular disease, has received little attention. The use of arts-based approaches can be used to evocatively represent and create meaningful knowledge dissemination about the experience. This art exhibit provides a thematic pictorial view of the themes gleaned from narratives of individuals as they journeyed towards recognition of the symptoms that led to their heart attack. Adult participants, 48 to 78 years of age, were recruited from a cardiovascular rehabilitation centers in Southern Ontario, Canada. Individual interviews were conducted exploring possible early warning signs, prodromal symptoms of ischemic heart disease development to revise an original prodromal symptom screening scale. This is a glimpse into the journey and the tensions around time.
Imagine yourself getting ready for your typical workday. You get out of bed, get dressed, and know that the next step is to go to work. But instead, you find you cannot leave the bed and are still sitting tired from lack of activity. Over months, weeks, and days, you find yourself increasingly unable to perform the simplest of daily tasks as you feel an insidious, creeping battery drain of your energy. Your endurance is gone. You're always so tired. Accompanied with the fatigue was a sense of foreboding.
The series, titled Borrowed Time, consists of a series of 4 sequential images depicting the experience of overwhelming cardiac prodromal fatigue. A fatigue that was all-consuming and caused simple activities of daily life, such as getting dressed or making the bed, seem insurmountable. The stark contrast of black, white, and gray metaphorically represents a level of uncertainty and a confusion, a haziness as to what exactly was happening. This confusion was met with a sense of foreboding that something was not right. Participants described this time as a period of going towards something they could not recognize or define clearly, leading up to something, as if there was an urgent sense of running out of time, that they were on what they described as feelings of borrowed time.
Picture this. He is up on a ladder, cleaning up the eave troughs in the autumn, as he does every year at this time. The air exudes the smells of the leaves returning to the earth. The wind blows softly as he watches the leaves swoop down gently onto the ground. He notices a gripping pressure in his left chest area and a wave-like ache in his elbow. The pain comes just long enough for him to take notice and rub his chest. It fades away. He shakes it off as if nothing. Finishing his yard work, he thinks he must have pulled a muscle. He's achy all over his chest. The intensity increases. He thinks, this thing is happening again. In the middle of his sleep, he is awakened.
Participants did not associate intermittent periods of chest pain as a cardiac symptom. Repeated experiences of chest pain were not understood as a threat or regarded as signs to heed until pain symptoms occurred with regular frequency and increasing intensity. Pain could no longer be ignored. Chest pain was a symptom that evoked an immediate sense of fear that time was being lost or cut off, as this pain is not going away and not getting any better. Photo Series 2, entitled Timed Out, which metaphorically portrays the raw pain that the participants all expressed. The occurrence of repeated bouts of chest pain connected with a sense or an awareness that he could no longer ignore his symptoms. Pain is unrelenting and not going away, and his time to recognize this warning has run out, with a heart attack now upon him. The person in this picture is trying to push away the pain. The pain cannot be ignored and is taking over his body, represented by hands clawing, gripping, and digging in flesh, the exact words used by many of the participants. The photographs are taken with a bird's eye view and reflects the shadows on his face and of the pain expressed. This pictorial representation captures the vulnerability and feelings of being exposed by the raw pain. The covert, emergent sense of time is revealed. Indeed, he has timed out.
Recovering from what could have been a fatal end. Most participants could not believe that they did not recognize the warning signs earlier and felt embarrassed and angry with themselves. Accompanying this were feelings of joy that they survived and renewed hope, realizing that living with heart disease is manageable. They also reflected that they gained knowledge of warning signs of which to be aware of in the future. Participants recognized that they had a second chance at life and expressed appreciation that they were given the gift of recovered time.
The series Recovered Time contains 3 images that portrays the person who has survived a heart attack. Although she feels annoyed at not recognizing her cardiac-related symptoms earlier, she realizes she has been given renewed time to recover and to live. The model in this representation viewed recovered time as an opportunity to enjoy the simple pleasures of life and expressed gratitude, thankfulness to be alive, and she felt very lucky at having a second chance. Deliberately drawing on the aesthetic benefits of visual arts helps to weave together science and art. Arts-based approaches assist in helping us understand an individual's experience of living through an illness such as heart disease. Arts-based research offers us the ability to create and convey meaning that transcends the limits of language. In doing so, it creates a space of recognition and stimulates deeper conversations with colleagues, patients, families, society, and meaningful dialogue that can save lives. We want to acknowledge the sources of our funding: Brock University, Women's Exchange, Women's College Hospital, and our partners Cardiac Health Foundation of Canada and Heart Niagara. We would like to thank the participants in the study, all the men and women, and the research assistants. Thank you for your kind attendance. If you wish more information, please feel free to contact Dr. Sheila O'Keefe-McCarthy at sokeefemccarthy@brocku.ca. Thank you very much.